Today, let's answer this question. Are tests like EKG and echo enough, or when do you need more tests? So friends, if you have ever had chest pain or shortness of breath, your doctor has probably ordered an EKG or an echocardiogram. But here's the real question. Are those tests enough, or do you sometimes need advanced testing to really know what's going on with your heart? Let's break it down. So, an EKG is a quick test that looks at the heart rhythm and electrical signals. It is great for spotting any arrhythmias or abnormal heart rhythm. It can also spot a heart attack, and it can also find conduction problems like a blockage in the electricity of your heart. Let's talk about an echo. An echo is basically an ultrasound that shows your heart structure, the valve structure, and the pumping function of your heart. It can relieve any valve problems if your valves are leaky or too tight. It can reveal if there is weakening of the pumping function or if you have a thickened heart muscle. Together, these two tests are powerful, but they do not tell the whole story. Now let's talk about when can EKG and echo not be enough. So friends, sometimes the EKG and echo look normal, but our patient still has symptoms. So this is when we would go for more advanced testing. For example, if you have been having chest pain with exertion and your EKG and echocardiogram are normal, then we will recommend a stress test. A stress test can be a stress echocardiogram, it can be an exercise treadmill stress test, or it can be a nuclear medicine stress test. These specifically look for any reduced blood flow to your heart. Now, there is another new testing called CT coronary angiogram, and this basically is a CAT scan that can directly look at the blood vessels of your heart and see if there are any blockages. It does have some limitations in the sense that if there is a lot of calcium deposition, the X-ray gets deflected and it may not be able to assess it properly. Therefore, this is a better test for younger people less than 60 to 65 years old. Then we also have the cardiac catheterization test, and that is actually the gold standard if we strongly suspect significant blockages or if the stress test has been abnormal. And we also have cardiac MRI. So, if we want to see more details about the heart muscle damage. So, if we want to see more details about the heart muscle, if we are suspecting inflammation or congenital disorders, then a cardiac MRI will be very helpful and necessary. So, friends, in short, a patient can have a normal EKG and a normal echo, but still have coronary artery disease. And that's when we escalate testing when symptoms don't match our basic results. So it's not about doing every test. It's about the doing right test at the right time. For example, if I see someone in the clinic and they are having exertional chest pain, I may get an EKG, but I may skip the echocardiogram because I'm not suspecting heart failure, and I may go straight to a stress test. On the other hand, if I suspect heart failure symptoms, I will not need the stress test and I will go for an echocardiogram. So, your doctors consider a lot of things before choosing the right test for you. Number one is obviously your symptoms. Is it mostly chest pain? Is it shortness of breath? Is it breathing? Or is it fainting spells in which you may need a cardiac monitor? If you are having palpitations, you may need monitoring for a week or so. Then your doctor also considers your risk factors. Do you have high blood pressure, diabetes, family history, smoking, cholesterol, whatnot, because these will help to decide what is the chances that you could have undiagnosed blockages, and accordingly, we will use the test. So, friends, EKG and echo are great starting points, but they don't always give the full picture. So, if your symptoms persist or your risk is high, don't hesitate to ask your doctor if you need more testing. Remember, catching heart disease early can save lives. I am Dr. Toishi Sharma, Interventional Cardiologist, and if you found this helpful, hit like, subscribe, and share this with someone who cares about their heart health. See you next time. Thank you.